So let's compare some of the options out there to treat obesity. First, let's compare it all to a placebo, a simple sugar pill. So if I gave a patient a placebo and said, this pill will help you lose weight, patients will lose weight. There's a little mind over matter for sure. And on average, patients will lose about 5% of their excess body weight. But the problem is that this weight loss does not persist over a long period of time as expected. So next, let's compare that to diet and behavior modification. There's a lot of different shakes and diets and gym memberships and training sessions out there, but we're going to lump them all together here. The average person that sets their mind to lose weight on their own will lose about 10% of their excess body weight loss. And that's a great health modification. Patients start to see benefit from that. But the problem is that's really hard to maintain on your own lifelong. And so lifelong, patients will only maintain about a 1.6% weight loss after they get about 10 years out from that change. So then let's compare it to the drug therapies that are out there and available to us today. These are all FDA-approved medications that have shown at least a 10% weight loss with their use. The problem with these drugs is that they only work for the time that you're taking them. So if you come off those medications, the weight will notoriously come back. So let's compare to the big three surgical options that we have for weight loss in our community. First, let's talk about the gastric bypass, what I would consider the Cadillac of bariatric surgery. This surgery is certainly tried and true and has been available to patients for decades, but it really has changed over the last several decades too. Patients have very small incisions and oftentimes go home the day after surgery. Patients can expect a great deal of weight loss, upwards of 85% in the first year and a half following their surgery. That weight loss can be maintained with the support of a bariatric program such as the one offered at Christiana Care. The gastric sleeve or sleeve gastrectomy is a somewhat newer procedure, but we've been doing it for over 10 years. Patients receive very small incisions and go home the day after surgery. They can expect upwards of 70–80% weight loss in the first year and a half. And again, that weight loss can be maintained with the support of a bariatric program. And lastly is the gastric band. This has fallen out of favor in most institutions across our country, including Christiana Care. This procedure is an implantable device and will provide patients with about a 50% weight loss at around 2 to 3 years. We will talk in a few minutes about some of the drawbacks to the gastric band. Weight loss surgery provides the best, most effective weight loss for patients struggling with morbid obesity, and is also the longest lasting treatment available for our patients. So who is a candidate for bariatric surgery? Well, a lot of your requirements to become a candidate are based on research, but will be important when it comes to insurance coverage. So let's review some of them. Patients are required to either have a BMI over 40 or a BMI between 35 and 40 with 1 or 2 medical problems. Your insurance company will dictate whether they expect 1 or 2 medical problems. They will also dictate what medical problems are included in that list. Oftentimes, diabetes, obstructive sleep apnea, and hypertension are among those medical problems expected. The insurance companies also expect patients to have a failure of non-surgical means to lose weight. Do they want you to fail? Absolutely not. What they want you to do, and what we also support, is for you to undergo nutrition classes prior to your surgery. This will help educate you on diet and exercise well before the surgical change. We also ask patients to be committed, and this is a lifelong commitment to changing things like diet and exercise in order to maintain your health. We are now going to review some of the surgical options that are afforded to our patients here at Christiana Care, specifically the gastric bypass and the sleeve gastrectomy. We will also briefly talk about some other options, including the gastric band and duodenal switch. So first, let's talk about the gastric bypass. This is a minimally invasive surgery. We place instruments through the abdominal wall in order to function inside the abdomen. We blow the abdominal cavity up with CO2 in order to find working space within the abdomen. We use this great stapling and cutting device to staple away a small pouch from the rest of the stomach. This is how much you can eat at one time, usually around 3 to 5 ounces. This small gastric pouch needs to drain, and so we attach it to a piece of small bowel. And you can see downstream we reattach the small bowel. And so this is a great schematic of what happens to your food when you eat. The blue is the food, and the yellow are the enzymes that break down food. And you can see that they don't mix and make green until well downstream. So not only are we restricting how much you can eat, but we are also restricting the body from absorbing the calories that help you gain weight. Next, let's talk about the sleeve gastrectomy. Again, this is a minimally invasive surgery done through very small incisions in the skin. The stomach resembles a sack, and we actually trim the stomach down to the size of a banana, and you may hear some patients refer to this as the banana surgery. We use that same stapling and cutting device to remove approximately 70 to 80% of your stomach. There are a couple important things in that stomach that we remove, including a hormone called ghrelin. Ghrelin is the hormone that makes you hungry. And so oftentimes after the sleeve and the bypass, patients actually have to be reminded to eat every 2 to 3 hours. There are even apps for your phone that set timers for you to remind you to eat every 2 to 3 hours. The sleeve gastrectomy also influences the hormones in your body and help the body from absorbing as many calories, just like the gastric bypass. Briefly, let's talk about the gastric band. The gastric band is an implantable device. The band gets placed around the very top part of your stomach, restricting how much you can eat. There's a cushion on the inner surface of that band connected to the catheter that then connects to a port that you can feel through the skin. Starting about 2 weeks after surgery, a needle is injected through the skin into that port, and saline is injected into the band. The band will then tighten, restricting even more of how much you can eat at a given time. Multiple injections and adjustments to the band may be necessary to reach the ideal state where a patient feels full but can still eat. Another option for weight loss surgery is the duodenal switch. This is performed very rarely and for very few patients. If you're interested in the duodenal switch, we'd be happy to discuss it at the time of your consultation.
I had lap band done 11 years prior, so I was pretty limited on what procedure I could pick. And the only way that they could really ensure good health for me was to go with the gastric bypass, which was a very good decision.
In addition to my own research, I also had Dr. Halbert and the Christiana Care team help me figure out which option was best for me, and that's why I chose the sleeve.
She put my mind at ease as far as the surgery, gave me the options that I had and what would be best for me with my condition, and the gastric bypass was the best option for me.